Well, while 2,400 employees of the CDC were fired this week, the agency's top spokesperson quit. Kevin Griffis says public health policy must be guided by facts and not fantasy. And as the head of communications, his conscience would not let him misinform the American people. Kevin is now speaking out, not just with us, but in this recent op-ed for the Washington Post. He says he left his job leading public health messaging for the CDC because he just couldn't stomach what he was seeing. In just the first couple of months of the new Trump administration, Kevin says HHS Secretary RFK Jr. and his team bent science to fit their narratives rather than letting facts guide policy. And with the U.S. now dealing with a measles outbreak and worries about bird flu, he is warning all of us that the CDC is not prepared to meet this moment and take care of America's health. Kevin Griffis joins me now. Kevin, good to see you. You said one of your biggest concerns was how Secretary Kennedy and his team was responding to the measles outbreak. Tell me what you witnessed.
Yeah, over and over again, and first, thanks, of course, for having me here, Kira. But over and over again, what we saw is that instead of talking directly to our experts about what they're doing on the ground, how they perceive the outbreak, instead, what they're being asked to do is to try to chase down support for some of Secretary Kennedy's ideas about how best to treat measles. For instance, the suggestion that vitamin A is in some way preventive of measles, or that antibiotics can treat it. These are things that are not supported at all by data. And we're seeing this over and over again where his statements just don't match up with facts.
So you were also worried about this major shift in informing the public of health threats. What happened?
Well, it's something certainly I wrestled with for a long time. I mean, the job at CDC is one that I really love. It's a huge privilege every day to go to work with people who are the absolute top experts in their field and who care deeply about protecting the health of the American people. But over and over again, we were seeing these flights of fancy from the Secretary Kennedy, things that he was saying that were inaccurate about public health, and that creeping into his recommendations for disease outbreaks. We saw that with avian flu and with measles. And so the only conclusion that you can come to after time is that, number one, as the top communications person at CDC, I'm really in an untenable position where I can't defend the things that the secretary is saying. But then number two, it's important for folks who are in the position to do so to invest in other entities, independent organizations that may be able to provide information to the American people when they need it, so they can make the best healthcare decisions for themselves, and ensure that the database, evidence-based information is available to everybody when they need it.
Do you think we're going to see a briefing soon? Will we actually see Bobby Kennedy step up to the mic and take questions?
Well, one of the things I would love to see is for the CDC independently to do briefings on the outbreaks that are happening right now. Since the start of the Trump administration, there hasn't been one. We have not held a briefing on avian flu or measles or anything else to inform the American people or the scientific or public health community about what's going on the ground. And that lack of communication isn't just in these sort of big public settings, but in the sort of some of the one-on-one discussions that need to be happening with different public health organizations to make sure that they have the most up-to-date information. Medical information changes all the time, every day. It's important that we keep that sort of loop going in a uninterrupted way, and that's not happening right now. And that could have impact on people's individual health down the road, and that's what we want to try to prevent from happening.
So, Kevin, you wrote in your op-ed that Kennedy tasked his staff to spend precious hours searching medical literature in vain for data to support his preferred treatments. What did you see? What did you witness?
Yeah, literally just that. So instead of talking to the folks who are experts at CDC on measles, the secretary hadn't, but when I left last week, had not received one briefing directly from CDC about the outbreak or about measles. Instead, he's been talking to folks who are really on the fringes of the American medical system about their different ideas for treating this. One thing we know that works is the MMR vaccine. That prevents measles, and it has a very good track record and a very good safety record. And that's what we need to be encouraging, not alternatives. But that's what indeed our folks were being asked to research to try to track this down. And this is a complicated outbreak in a close-knit community in Texas and New Mexico. And it's going to require some creativity and a lot of focus. And instead of working on that nonstop, folks are doing work that just serves no real purpose beyond trying to satisfy the secretary.
Well, Kevin Griffis, I hope we can bring you back as things move forward. Would love to continually get your insight and thoughts about the new administration, in particular Bobby Kennedy as HHS Secretary. Thanks, Kevin.